Hi, I'm Roy Herbst, Ensign Professor of Medicine at the Yale School of Medicine in New Haven, Connecticut. I'm also the Deputy Cancer Center Director and the Assistant Dean for Translational Research. I, along with my co-chairs, Dr. David Gindera and Dr. Heather Wakely, would like to invite you to the 23rd Annual International Lung Cancer Congress. This multi-day educational conference will take place from July 28th through July 30th, 2022, live and virtual at the Hyatt Regency Huntington Beach in sunny California. Cutting-edge lectures, extended panel discussions, multidisciplinary tumor boards, and question and answer sessions will allow participants to engage with international and national experts. I'm excited to be here again. I've been here for almost all the 23 years at multiple locations, and I'm excited because there are many new things this year. Despite the pandemic, progress is being made in lung cancer like never before. At AACR, we heard about Checkmate 816, neoadjuvant nivolumab in patients with resectable lung cancer. We're hearing updates on new targeted drugs, such as those targeting KRAS. Studies from the LungMap portfolio presented at ASCO will be discussed at this meeting. And really the most important thing is how all the different inroads in lung cancer, whether it be targeted therapies for a driver mutation, immunotherapy in the sensitive or even the resistant patient, and then multimodality therapy with surgery and radiation can all be combined to improve patient care. As we all know as clinicians, that's never simple, and it requires discussion, questions, and interactions. And you'll have that no matter how you join our meeting, either in person or virtually. I think at this meeting, some of the most beneficial topics will be the updates in immunotherapy post-ASCO, AACR, and then certainly some of the new targeted agents. You need a scorecard to keep track of all the new mutations and the drugs that are being developed for resistance for the many different pathways we study. This, I think, will be exciting. And again, my favorite part of this meeting really is the multimodality discussion, getting together with the surgeons, the radiation oncologists, the pulmonologists, those involved in health disparities, to really talk about how to best give care to our patients. Many ask, how do you utilize the information from this meeting? How did I utilize what I learned last year? I can remember very well that going to California last year, my first trip in quite some time because of the pandemic, I really updated on many of the new targeted agents. It's incredible how many drugs have been improved in oncology in the last several years. We learn about the agents, about their targets, the exon 20 drugs, the newest EGFR inhibitors, the antibodies against EGFR MET, some of the newest combos that we use in immunotherapy. All these things will be discussed at the meeting, integrating this into our standard of care with discussion, with polling questions, with audience remarks. And then, of course, I learned, I met colleagues, I interacted. I learned a little bit more about how to treat patients with this disease who are making so much progress, but will continue to make progress by having meetings like this. I am thrilled to be attending again this year, and I'm honored that I've been asked to again co-chair. I look forward to seeing many of you there, either in person or online, because we have to work together. We have to take the newest information and translate it into the clinic. And that's what this Congress always does. We look forward to seeing you there.